Glad to see familiar faces because I'm terrified of like public speaking. But as you know, and some of, if you're in any of my labs, I do have the ability to go gabbing on and on and on when I'm amongst friends. And so then speaking in public, though, is kind of different for me. And I'm like really terrified. So I'm going to try not to babble. And I do have like some notes. So I'm going to kind of stick with my notes. I've got Morgan smiling at me too. So good. Okay. So if, people have questions or anything, they can put it in the chat. I can't see the chat right now because I'm trying not to multitask too much, but I'll get to the chat at the end. I'll leave time. And if anybody has questions or wondering about something I say. So I'm going to start off with just telling you that despite my age, I'm kind of a new tech. I had other lives, other careers going on before I became a vet tech. I graduated from SUNY Delhi in 2013, which for a lot of you that are young, you would say, oh, well, that's kind of a long time ago, but really wasn't that long ago. People like Erica McKee and certainly Kathleen Ogborn and Jackie Howard, they've all been techs for ages and ages, and I haven't been that long. Graduated and had my exam in 2013, and I right away went to work at a specialty practice, a 24-hour emergency and specialty practice. So it was definitely hit the ground running. I was not prepared for it. I had all my SUNY Delhi training, but I kind of thought I knew more. And I realized as soon as I got out there, I knew like so little. And so I hope all of you, as you get out into the workforce, you get into practices that they understand that you're just learning and you're going to catch up, you're going to learn quick, but don't expect to know everything, because any good practice will know that you're new and will cut you that slack and take the time to train you right. But my previous life was out on the West Coast. I lived in California for ages and did a totally different thing out there. And now we live in South Courtright, and we have a little farm. We're really, really short on animals right now, but we do a lot of organic vegetable and fruit growing. And I've got 2 adult sons, not a whole bunch older than most of you, but in their late 20s. And I'm super proud of them. Anytime you want to stop in my office, I'll show you pictures of them because I think they're awesome. But anyways, so what happened was I got into this vet practice, super fast paced, and just this load of stuff going on because there were emergencies like triages all the time. There were regular appointments, and then there were specialty vets there for oncology and ophthalmology, herbal medicine doctor, behavioral doctors. I mean, there were just like these ton of really highly skilled people, all that stuff going on. And in the shuffle of it all, of me trying to get my feet on the ground, which wasn't very graceful, there was a tech that was working there who had been a tech for ages and ages, super experienced. And she had worked previously at a hospital down in the city that dealt only with treating cancer in companion animals. So that's what she did. That's what she knew a lot about. And so she was always at the microscope at this practice. And they had an Antech laboratory attached to the building, like a separate business. So we brought a lot of stuff over there, but they had kind of a policy that anytime you drew blood, we did a manual differential. And for those of you who are struggling with Clin Tech right now, and thinking that maybe once you get out into the field that you won't do manual differentials, there's really a beauty to it. It's a lot different when you're out in practice doing it as opposed to the stress of being a student and doing it. So I ended up doing just boatloads of manual differentials, probably, I don't know, 15 a day, maybe. I did a lot of overnight stints so that sometimes they were relegated to the late night staff to do. And so then I started getting into things like one of the vets did a lot of aspirate work. Their cytology with taking fine needle aspirates. And there was another vet who was doing the oncology stuff. And there was 2 orthopedic surgeons there that did a lot of joint and bone taps. So I was getting to see all this cool cytology, and here was this other tech who knew what she was looking at when she looked under the microscope. And so she kind of lured me in with this, oh, hey, Terry, come on over and check this out. This is so cool. And kind of got me hooked on cytology. And somewhere in there, early in that first like year or so, she said, you know, if you're really into it, you should check into the specialty of clinical pathology. And I didn't know anything about it, and I didn't know any techs that had any specialties. So as you see from my screen share here, I just Googled NAVTA, N-A-V-T-A, and I got there and I clicked on, and this is a great site. Even if you don't join, I've been a member for since I first started. There's the New York State Veterinary Technician Association that you're involved with as the student chapter. There's also a national chapter, and that's what this is, the National Chapter of Veterinary Technicians. And there's a lot of things I could say about it, but I'm going to kind of just skip over here. If you see specialties, you know, once you're, even before you're a vet tech, you can see what kind of things are here. And it's kind of motivational because to me, it's like, how could you ever be bored being a vet tech? It's like always new stuff, always cool stuff, amazing things go on every single day. But if somebody were to say, you know, it's kind of, if you ever got to the point where you're saying it's kind of the same thing, that's all on you. It's not on your practice, and it's not that you need to change careers. You just have to look a little deeper. And this is one particular area you can look deeper. So I was at the NAVTA site, and I clicked on specialties right up there. And I'm going to kind of just scroll down a little bit. If you've never been here, you're going to be amazed and hopefully inspired too. All right, so right here it says academies approved by NAVTA. And you're seeing, I'm not going to read all of them, but there's emergency and critical care, dental technicians, internal medicine, anesthesia, zoology, cool one, right? For anybody thinking of working with exotics or at a zoo. Laboratory animals, behavioral for anybody who wants to do animal behavior work. There's mine, clinical pathology. I'm going to skip past it for a second here to just show you all of these different specialties. A lot of you are into the horses, so there's equine specialty. Physical rehab is huge. You want to go into a big field, rehab is great. Nutrition can lead you in a ton of different directions with other jobs outside of veterinary practices. Sales reps, working for some of these food companies, nutrition companies. Ophthalmology, surgery, Diagnostic imaging. You can get specialties in all of these. There's also some societies, and they're almost like you would be joining like a membership thing. It's a little different, but you become a member to connect with people all over the world who are also interested in some of these more specialized fields. I'm going to go back up though to show you what this is exactly kind of what I went through when she said, oh, you should check into clinical pathology, not knowing anything about what she was talking about. And so I clicked there, and you can be very grateful that they've massively updated the website from what it used to be. And from there, it's saying about us. And so you can find out some information. Now, if you go on to any of these websites, they're going to tell you how to navigate through to find out how you would find out more about maybe not pursuing. Oops, I just want to click on one thing here. Maybe not. Hold on. I want to maybe move my face over a little bit. Darn it, because it's right where I want to click. Okay, about us. So the about us, blah, 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 Constitution and bylaws, kind of interesting, but you know, at least for me, I didn't want to really hear about Constitution and bylaws. But then the candidate packet of materials, it's going to go through some of the things that you would, if you're interested, if you want to find out more, it talks to you about the different things that you would need. And some of it might sound kind of daunting, like if you're saying 4,000 hours of clinical pathology. What you do with some of these things, whether you carry through with it all or not, is you can start gathering some information. You know, about some of the stuff that they're looking for. You can start gathering, because as a new tech, I had about 1 year under my belt, and you can't apply for this one in particular, and I think quite a few of the specialties, you can't actually like officially apply until 3 years later. So it's a couple years down the road, but in the meantime, you can start kind of thinking through, okay, I need to save some documents. I need to really learn how to do this or that. So it's kind of an interesting process, but mainly what I would say for you is to go ahead and go to that national site, the NAVTA site, and look through some of this stuff. Your possibilities as a vet tech are so limitless to all the things you can do, from practices to laboratories to sales reps to just this absolute mind-blowing amount of things you can expose yourself to in avenues your career can take. I know a veterinary technician who became blind. She had like a degenerative eye disease, and she's still doing vet tech stuff. She works as a rep, and you know, there's equipment nowadays that makes that possible for her, but she's a sales rep for one of the pharmaceutical companies. So it's not even if for some reason you become like physically worn out, emotionally worn out, there's still spaces for you. So don't give up. It's kind of shocking to me how the attrition rate of vet techs, why there are a boatload of jobs out there for you, is because unfortunately, a lot of veterinary technicians last, I think the average is 3 to 5 years in the field. It's like shocking. And it used to be, maybe just a tiny bit now, it used to be about money, that you just couldn't make enough money being a vet tech. And it really isn't true anymore. Most places, you know, some of these little community areas like Delhi, it might not be catching on quite yet, but the salary range is going up and up and up. And part of that is any technicians who have that extra training. Certainly a bachelor's degree really, I think, helps. I'm working on my bachelor's now, and I do not, under any circumstances whatsoever, I'm getting serious now, do not try to get your bachelor's when you are 60 years old. Don't do it. It's it's a bad mistake. Do it now. Get that bachelor's, because boy, it is not fun at 60. I'm not quite 60, but real close. So anyways, bachelor's degrees, they're paying more for bachelor's. They're paying more for anybody who's even saying you're pursuing a specialty. To, you know, consider those things. If you want, salary shouldn't be the factor anymore, unless you're going to engineering school, and then maybe salary does have a little bit difference to it. But otherwise, it's a good profession. You can earn a living from it. So what I'm going to do is stop sharing now and just go back to the regular thing. Oh, thank you everyone for being here. I'm really happy about that. So I just want to talk to you a couple things about, as I started looking into clinical pathology, it's one of those things like anything, like vet tech, you might have thought you knew when you came to this college that you knew a pretty good amount about cats and dogs. And then you got here and realized, oh boy, I don't know much at all about cats and dogs. And you just keep learning and learning. Well, that's how I am about clinical pathology. Is it's not like you get this specialty and you say, I have arrived, I am a specialist. I still have kind of this imposter syndrome going on because I have so much to learn about it. I'm still learning every day, and a lot from you students as far as clinical pathology goes. Some of the things that kind of moved me on with it, though, that happened in practice and actually happened at SUNY Delhi here since I've been hired here, is some of the patients I've run into that they had some really interesting, rare, and super serious conditions that it wasn't until through pathology, through looking at aspirates, body fluids, transtracheal washes, biopsy stuff, histologies, and definitely that blood and urine and poop. You find out stuff that no one else in the building is aware of, and you're like the CSI of that animal. And it's incredible. You get this like behind the scenes, this hidden information that you can share with the vet, bounce it past the vet, find out what they're thinking about it, and move forward. And you kind of feel like a little bit of a hero there, that you spotted something under the microscope that's going to really help them along. I had never heard of leiomyosarcoma before. Crazy serious condition. I worked for a couple years with a guy up in the Albany area, very successful. Money was no question. There was no money that wasn't good for that dog. He had a Pharaoh hound, and for a couple years now, we watched these symptoms that were going on with this dog. And I was able to see at the time that I was working there, to see this progression of a disease that was really rare with this Pharaoh hound. And it was through cytology work that we went about figuring out and being able to treat. And it was kind of treating the untreatable sort of thing. But I always remember that dog. Nala is her name, and I met her, years ago. And then there's Grayson, who was domestic short hair, who had a really unusual um, antibiotic resistant skin condition that everything that was tried was not working with this kitty, but the owners persevered. And so I learned a lot through these animals. And so then when I finally decided, I had my paperwork ready and the 3 years were up and I was going to submit these reams, and I mean like reams of paperwork to apply for my specialty. I got it all in and I qualified to sit for the exam and failed. And it was devastating to me. I was fully aware that that I didn't know it all for sure, but I thought I knew enough to be able to swing that exam. And I took the exam and it might as well have been in Swahili. I like not a clue. Most every question, I had no idea what they were talking about. Walked out of there pretty much knowing I failed. And I had been working on it for over 3 years. By then by the time I actually sat for that exam, it was 4 years I had been working on this. Well, I'm working, my regular job and gathering more and more information. It was devastating to me. I couldn't speak for days. It was super upsetting. And I think like most of us, we don't handle defeat really well. No, I think a lot of us don't handle it very gracefully because we're all kind of perfectionists and we want to be really good vet techs. And that was hard. So it was kind of through my husband's nagging, because I had spent so much time on that packet, that I decided I was going to reapply. And it took another year and a half because a lot of those original case studies were now outdated. So I had to start from square one on some things. And so I reapplied and didn't have a lot of confidence either, because I had been kind of crushed. But I said, if I try it one more time, then I can genuinely admit defeat. Victoria, thank you for smiling. I'm so happy to be watching you. And Morgan too there. Thank you, everyone. So COVID hit and the exam was canceled. And I was like, okay, well, I guess that's my sign, that, I'm not supposed to do this. It's not supposed to happen. And so then they came up with an alternative plan of having it proctored. And these are the sort of exams where you have to if you have to use the bathroom during the exam, they escort you in and stand by the stall door. That sort of exam stuff. No cheating, no phones, no scraps of paper, nothing. And so I was able to get a proctoring situation fixed up right here at SUNY Delhi, and I took the exam this last year. I think I should know, gosh, I should know, but it was like April or May I took it, and I passed it. And huge accomplishment. Specialties are not supposed to take 5.5 years to do, but so I don't want to discourage you that it takes that long to do a specialty. It's just, I'm kind of a slow learner and I take a lot of time to absorb stuff. And that's what it took. And it still just makes me realize how little I know about it, but it's amazing stuff for me to look under the microscope. One of the things with the clinical pathology specialty is, of active members in the US and Canada and Mexico, there's 11. I'm one of the 11 in the country. And so I'm proud of that. I'm kind of awed by it. And one other person passed at the same time I passed, and they're from Maine. And I found out she went to Eco Life also, just a couple months before I went with students a couple of years ago. So you make all these connections all over the place with people. So let me see, to stick with my agenda here. One of the things with these 11 people or 10 other people is that 3 or 4 of them work in a college. They're faculty, so they're teaching, like Jackie Howard or Elise, that they would be teaching clinical pathology. I don't have a desire to teach. I have thought about it, and I feel like it's a huge amount of time in grading and setting up your courses. They do so much behind the scenes work, and I've gotten these little exposures to how much work they do before they're actually standing in front of you in the classroom or on the Zoom. And I just can't do that. So I really love where I am right now. So then going back to those 10 other people, let's say like 4 of them, I think, work in like a Jackie Howard or Elise capacity. And the other ones all work in laboratories where it's a veterinary lab, like IDEX, like Antec, like maybe Abaxis, I think, I'm not sure about them, or like at Cornell, they have a diagnostic laboratory where that's what people do, is look at that stuff all the time. And I'm glad that that's not me. Because my experience and what gets me so excited about clinical pathology is following those cases where I see the dog, I see the cat, I see how they're acting, I hear what a vet is saying about them. I can look at what the machines tell me. I can look at a microscope. I can see them in a couple more days and see how they're acting. And it's that type of connection where you're using your eyes and your hands, but then also using equipment to get these whole pictures of what's going on. I love that. I just love it. Sometimes it's really sad stories. I've got stories, I have all these names written down on a sheet of paper of all these animals that I've worked with that were just incredible. They had rare things going on that the vets I was working with said, I have never seen this before. And they were looking up stuff, and I got to learn from them. And they were comparing notes with other veterinarians and learning and discovering too. So it's a pretty amazing thing. I love clinical pathology. I just really like it. There's no end. Definitely, you could never be bored with it. So let me see what else I wanted to talk about here. I think that's kind of it. I just wanted to tell you a little bit about myself and my specialty of clinical pathology. I think when I graduated from SUNY Delhi, I wanted to be a surgical technician. I wanted to be diagnostic imaging technician. I wanted to be, the only thing I didn't want to be was the dental thing. And I'm just like, I can't do the dentistry thing. I wanted to go into forensics, and I wanted to do rehab. And the thing is there's so many possibilities. Thank goodness you're all so much younger than me that you could go in a couple different directions in your lifetime. But you can't be, well, I shouldn't say it because there's somebody out there who will be, but it's would be near impossible to do it all. You just can't do it all, but kind of go with what the people that are put in front of you in your life that kind of lead you in a certain direction. Gabrielle, I see that kitty there. Sweet. So, be willing to learn and don't get bored. Be really wary of people who say they're bored. I kind of steer clear of them because like I kind of do my whole life like this is no dress rehearsal here. This is the real deal, and live your life. Get out there and do and be. And so I think that's about all I have. I did want to make sure that everyone knew my office is upstairs right near that back door where you do your card swipe. I think y'all have my email, although I know there's another person on campus that's named Terry Hamblin, and he gets a lot of my emails. And then he just sends them on to me because our names are pretty similar. But I think that that's about it. There's so many things I could talk about with like toxicology, animals that got into some kind of poison, and things with different emerging diseases. You know, I follow tuberculosis pretty closely in the veterinary world because that's one of these really hot topics in veterinary medicine, not so much right now in the United States, but it goes in waves, and it's a bad thing, but it's really cool for me to watch these waves. There's certain parasite problems you're going to see that will rise up that have never been a problem before. So, you know, constantly changing. And I'm going to stop talking now. I don't know if there's any questions. I guess I can check in on chats. You know, it looks like everybody's good there, but you need to just send me any questions, or if you ever, all of you, thank you for attending. So, you know, part of your little party bag, the little party bag that you would bring home, is that you get out into that veterinary world and you start thinking that maybe you would like to do a specialty or look into it. I believe all of the specialties say that you need to work with somebody or be in contact with somebody who has a specialty already. So here's my personal invite for all of you to get in contact with me. If you decide at some point in your future you want to look into specialties and need a little help or guidance or just my signature for something, you got it. And that's all I've got.